Good afternoon, ladies and gentlemen. My name is Pourmahram. I'm cardiac coordinator at Methodist Hospital at this location. You all heard about Dr. Rowe's situation when he started his program, and we are so proud that he appreciates what he has done for himself. Also, I heard only twice about cardiac rehab program. All was said about physical therapy. Also, we all are at the same field, but with different scope. Physical therapy has scope more on strength, and we have more scoping on endurance. So, but tentatively, we both are working very close at the hospital. And the cardiac rehab program is different from physical therapy program in every setup at hospitals or clinics. So this exercise program, should I push the green button? Okay, yeah, all right. I would like to talk about a little bit of time on exercise, how you need to do it. But the important information that you need to know is about yourself. How much activity you have done, what diagnosis you have, and if you need to do some exercise with precaution, you need to discuss it with your physician first. And then when you're going to cardiac rehab or exercise physiologist, then discuss your needs for physical activity. You need physical activity, absolutely. But it doesn't have to be so aggressive. You can start with a little as 4, 5, 6 minutes, and then gradually increase your time and intensity when you do exercise. Do not start with about 25, 30, 40 minutes with brisk walk that might have more harms than help. So, but what you really need to know is, you need to know what is your resting heart rate, what is your resting blood pressure. If you're diabetic, what is the level of your blood sugar before you do exercise. You need to know all of these numbers first, and then you need to set up an exercise program with the help of specialists to have an exercise which is planned, structured, repetitive, and for a purpose. So I would like to say, if you have not done anything, start with resting heart rate and see what it is. Whatever is your resting heart rate, do not increase your heart rate during exercise more than 20 beats above your resting heart rate. That is a safe way to start with. And also, you go for about a few minutes at a time, about 3, 4, 5, 6 minutes at a time, or if you can tolerate more time, is okay. Always try to have the numbers on your blood pressure. If you have a high blood pressure and you have to take your medication, do not forget your medications. Take your medication and give it about an hour or two, and then do your exercise. If you have high blood pressure, very low blood pressure, do not start exercise until you are fine with the range of your blood pressure. Also, if you are diabetic, make sure you check your blood sugar before you do any activity. If you go for about longer than 10, 15 minutes, do not let your body has less blood sugar when you do activity. These are the things that you need to check with before you do your exercise. But as far as exercise, walking, bicycling, do these too. These are the great exercise on the earth. You all can do that with no doubt. So if you do these exercises, you definitely will get improved on your blood pressure, on your heart rate, on your cholesterol level, on your blood sugar, and on your stress and feeling. That's important to just focus on the timing and the level of your exercise you're doing. You will get fine. It won't come overnight. Dr. Rose has done that for about 7 years with us. And he knows how to do it. It started as phase 2 with a monitoring on his chest. And we monitored his heart function during the activity. And after he was graduated, he started his own, but still, he is coming to us for phase 3, which is maintenance, and he does all by himself. The only thing we do is checking his blood pressure and heart rate. That's all. And he knows how to do it. And you will learn as well. But the important is make a pledge to do some physical activity for your own health. And I'm sure you all can do that. So what to wear? Comfortable clothes. You don't have to put the exercise clothes, but do not go outside in the heat and do exercise. Stay at home and just walk over. If you don't have much of a space, you can do just marching in space and do your exercise, moving your arms up and down, sitting and standing up. Or if you have a bicycle, stationary bicycle, you can ride that with the low intensity. Time is more important on exercise than intensity. So start with time. Intensity should be low, but your time gradually increase it. And if you need to have your oxygen with you, take it. Do not leave the oxygen aside. Try to make a shorter resting between your time. If you're doing about 4 times of 5 minutes or 10 minutes during the day, try to make the short rest between them and longer your time on exercise till you can put them all together and go for about 20 to 30 minutes of exercise once a day, every day. And if you can do it every day, do it at least 3 to 4 times a week. This should be your exercise time. When I was sitting down there, I saw some faces that are getting a little bit sleepy. We have discussed that before, and I think if it's okay with you, if you don't have any excuse, if you are fine, do a little bit of stretching or moving your arms and legs while you're sitting. Anyone who would like to participate? First, please put your hands together for Dr. Larry Rose, which is a champion of our program. I spoke with some patients, some audience this morning. They have gone through the same program, and they have the same feeling about cardiac rehab. Please put your hands together for Dr. Rose. Now, I want you to move the things from the desk around a little bit on the side. Open up your eyes. Put your hands on the desk. Relax on your shoulders. Everyone, if you can do it. Now, take a deep, slow inhale and a slow exhale. One more. Turn to your right and hold on to the chair. Turn to your right and hold on to the chair. And look at me. Thank you. Yes, just hold on. Hold on a few seconds. Now, to the left and look forward. Look forward, relax on your shoulders. And breathe, do not hold your breath. All right? Put your hands on the desk, lift your shoulders and roll them forward. Keep your chin up and breathe. Opposite direction, lift your shoulders and roll backward. Excellent. Very good. Now, depends on how much space you have. Move your arms up. Thank you. Move your arms up like this. Flex your biceps and down. Now, exhale and move it up. And inhale. Exhale. Inhale. Exhale. And inhale. Now, do the shoulders. Bring your arms straight up and exhale, shoulder level.
Looks good.
And relax, relax. Thank you. You're doing great. Okay, next one. Ankle circle. Just bring your foot up and make circles with your toes. Few times, make circles with your toes and opposite direction. He does, every time he comes to the rehab, he goes through these exercises, and then he goes on his bicycle. He has a special bicycle. Okay, that's only for him. Now, change the foot and rotate. And opposite direction. Very good. We don't have much of space on the seat to move all the legs exercises. I want you to do only one of them, which you relax on your shoulders, hold on to the side of chair, and bring your knee up and down, up, down, up, down, one more, up and down. Do the other leg, up, down, up, down, up, down. Last one, up and down. Okay, put your arms on the desk and take a deep, slow inhale again. One more. Was that easy or hard? Easy. Please repeat it at home 3, 4, 5 times a day. And if you need more information, we're sitting out there on the table. If you don't know how to check your heart rate, if you need to know more information about blood pressure, range of blood pressure, and the places that you can get some professional help, stop and talk to us. Thank you very much for your time. Good. Thank you.